I'm Molly Tickner. I'm the President of Clinical Services at FosterAdopt Connect. We know that kiddos that are in foster care or adoptive really come with us with a high complex traumas, and so we designed this program to make sure that we can really meet those needs. We were able to design a program where it's not just seeing the client for 1 hour a week of traditional talk therapy. We're able to make sure that our staff are clinically trained in trauma-focused therapies, so they have the certifications and the credentials in order to be able to really address the trauma of the families and the youth that we serve. And we can go beyond that 1 hour of traditional therapy. Our program is based on what is best for the client. Do they need a longer assessment process? Do they need both individual and family therapy in the same week? What are some of those specialized services and groups and more complex therapies that we can use with them? Because we are truly holistic. In addition to having clinical therapists on our team, we also have a medical professional who is a developmental psychiatrist, physician who can treat them and serve their medical needs and their psychiatric needs. We've also hired a clinical psychologist who can do psychological testing, intellectual testing, developmental testing, and diagnostic testing. So we're really providing that wraparound support. So when you talk about traditional therapy, that's kind of like where you and I would sit down and have one-on-one therapy, whereas what we're looking at is what are some other therapeutic interventions that we can help the family? Like, does the kid need to go and do sport? Do they need movement? Do they need more of a play structure? Do they need to incorporate art, more sensory-based interventions? So that's when we say holistic, we're looking beyond that traditional one-on-one talk therapy and looking at what else can we do to really address the needs of the families and the youth so that our kiddos are staying in their homes, so that they're not going into residential treatment, so that adoptions don't disrupt. Within this population of foster care and adoptive youth, there's only so many providers in the area that will take their insurance if they have Medicaid or a Medicaid managed care organization. Plus, there's just a limited capacity, especially with COVID-19 and the pandemic. We've saw an increase in mental health issues with our youth, and so there's just a lack of access. So the gap that we filled was not only being able to provide clinical services to this high-level population and quality services, but also being able to provide that higher level of care.